My name is Mina Jelacic. I am a doctor, now finishing a specialty in physical medicine and rehabilitation. I'm also working like a physiotherapist and orthopedic technician. My field, I can say, is idiopathic scoliosis. So this is actually what I mostly do. It is interesting how I started working with scoliosis, because actually this was never my plan when I was studying medicine. Let's say that the experience that I had as a patient took me away from this this part of medicine, and I wanted to do whatever, but not to treat scoliosis patients, because I was not very happy with my treatment. So I didn't want to be part of this. I decided to be a doctor when I was in high school. I was always interested in biology, in nature, let's say. For some time I thought I'm going to be I'm going to treat sick animals, let's say. But then I was consulting with several people, and in the end we decided that the best would be to go. I can say that my contact with scoliosis started when I was very young. I had, I don't remember well, but 7 or 8 years. When I was diagnosed with idiopathic scoliosis. I got a brace to wear. It was a classical Boston brace, and of course specific exercises and swimming as usual. So this is something that I was doing for quite a long time, until my age of 17 or 18. I was wearing a brace. And then in the end the curvature progressed. So the first values were around 20 degrees and 10 degrees, because I had from the beginning 2 curvatures. And then in the end they had both of them around 45 degrees. So in the end the surgery was suggested. But my family and I, we were not very happy with this suggestion, and we actually didn't want to accept. So I decided to continue living with this scoliosis, because the growth was already over, it was finished, and I decided to live with it and to find ways to help myself to have as let's say to have a good quality of life. Maybe this is the best way to say. Okay, so to have less problems because of scoliosis. This is how I found. I was looking on the internet about treatment techniques, different methods that I can maybe try on myself, and it was just a coincidence. I got some information in that time. There was not a lot of information about Schrott, German method. So I think it was, I went to Spain first at 2008. So maybe a year before that I found information about these exercises. I liked it very much and I wanted to try. So I have ordered a book. I remember that they did not have an English version, so then I was very keen on having it. And then I ordered the Spanish one, because I already knew Spanish, not very good, but I thought I will be able, reading the book, I will be able to do these exercises. But what happened is that when I started reading the book, I realized that that's impossible. It's first I thought maybe my Spanish is not good enough, I cannot understand. But then I really realized that this is a very complicated technique, and then I have to go to one of those two places where the people are doing a good job. So I found information about Katarina Schrott Clinic in Germany and about Dr. Rigo's place, Barcelona Elena Salva Institute in Barcelona. I wrote to both places, but Dr. Rigo was the only one who answered. And on the other hand, Barcelona is a very nice city, and I like Spain and Spanish language, so it was not very hard for me to decide to go there. So visiting Barcelona and Dr. Rigo was something extraordinary for me, let's say, very, very good experience, and something I could just dream about in that time. So I told you that I wrote to both places, to Dr. Rigo and to German school. Dr. Rigo responded. But as my family, I was not telling a lot about what I'm doing to my parents. So actually, they were not informed about my my mail to Dr. Rigo, and I was just I asked about the prices, because you know the prices in Spain and here in Serbia are very different. So we are, I can say, low cost country. Low income, how to say it. It's not very easy. At that time, it was not very easy for me and for my family to go to Spain. So I was also concerned about the money. And I asked Dr. Rigo what are the prices and when can I come and how can we actually arrange it. And then he responded that he's going to reduce the price 50% because I'm medical student at that time, and it was a very big shock for me. I did not expect something like that. You know, I don't know him. This was the first time I have sent him just an email, and then he reduces the price 50%, and I was not asking for reduction. I just asked about price, you know. And as we were in the period before, our country had difficult, let's say, difficult periods, okay, with wars and let's say crisis, difficult situations, and a lot of people here they were like. All the time frightened that something wrong can happen, you know. And then my family was very suspicious about Dr. Rigo's proposal. They said me, you know, here something is wrong. He does not know you, and he's reducing the price. And also he helped me about, he gave me a suggestion to have a low-cost accommodation, student residency near the institute, which was much cheaper than any other way of accommodation. And then my parents told me, you know, there is something wrong. So people like that does not exist, you know. So you will go there, and who knows what can happen. Before that, I was 25 years old, and before that, I was not traveling a lot out of my country alone, you know. So. That was the time when I wanted to go alone to Spain, to unknown place, you know, and my parents' first reaction was that I cannot go because it's suspicious. You know? But as I insisted, then they contacted Germany, some friends in Germany, to check if there is really a clinic in Spain working with this method. So they made a kind of research to see if this is really safe to do and to go. And this is how they, in the end, gave me permission. This is maybe not now very important, but then when they decided that they will leave me, they will give me the opportunity to go, then my younger sister also raised her hand and told me, I also want to go, you know. So then we went together. So my sister and I, she also has scoliosis, not the big one, but she has scoliosis. And then she was also included in the treatment with Dr. Rigo. So this is how this started. So my first visit to Dr. Rigo at his clinic was, I went like more than half an hour earlier to be there on time and everything. And I was very happy with the first contact with Dr. Rigo. First of all, he was a doctor who was not judging. He was not telling why you should do this or you should do that, or why don't you go to surgery. So he was very supportive. He looked at my back and the x-ray, and he listened to me, my idea. I explained him that I did not want to go to surgery because I have no functional problems. I don't feel that I have any limitations. My growth was over, so there was, let's say, not a big risk to progress, for the curvature to progress because of growth. So I thought that maybe the curvature can remain stable, and then the only real reason would be because of the aesthetics. But then I told him, if I don't care about that, if this is not such a big problem for me, why should I go? If I can live with this asymmetry of my back, I don't think that the surgery is something I would like to do. So this was my point of view. I explained him how I feel, and I was very happy that I actually found someone who can understand what I'm telling, and who wanted to help. Until then, I thought that I know a lot about scoliosis because I lived with it for long period of time. And I really tried a lot of things here in my country. Whatever I could try, I tried. So I thought that most of the things I have already seen. And of course, this was a method that I don't know, but I thought that I have high level of knowledge about scoliosis. But then I realized that I know nothing. So when I started doing exercises with Monica, I was in a group. We were 8 in the group with Monica, and first 2 weeks, it lasted for 1 month, and first 2 weeks were like, I don't know what I'm looking for here. So I was like lost, and I thought that I made mistake, because I always did the exercises like, I don't know, for the abdominal muscles, classical. Then, classical kind of exercises for making muscles stronger or stretching, but the classical way, And then someone is all the time telling me about the elongation. I was like, I cannot do this anymore. This is not the exercise. When are we going to start exercising? This was my, so I really needed time to start feeling what we are doing, because during the exercise my feeling was not, I could not feel my body very good. It was like when Monica started correcting, she says, oh, this is fine, but I don't feel this is fine, I cannot. First 2 weeks were like, I was very lost, I was very confused how my shoulder should be, my shoulder blade. Am I elongated enough or not? Where is the pelvis? So I was opening collapses was like, okay, I understand what you are telling to me, but I think that it's impossible that I can do this, because my body is not listening to me. It's like when you, for example, have an injury of your spinal cord and you want to make a movement, but it's not happening. It was the same. So I wanted to open and to do, but I did not feel that this was happening. So I think also that the problem was in the strength of my muscles. I was very strong. I was all the time working on strength, and all the time I was trying to push more, but to push more without previously making good corrections. So I was kind of making a blockage of what should be done. So this was, I can say, maybe for first 2 weeks. So when I realized about the effect of the exercises and what actually means the correction of scoliosis, so I was like, wow, So my whole life, from my age of 7, 8 to 25, I was thinking that I understand and I am like taking care of my scoliosis, doing exercises, wearing braces or whatever. And then you realize that this was nothing. Okay, it's like disaster, okay? But so from one side, this was for me good and bad experience. Bad experience because I realized that all my effort was not going in the right direction before. But also good experience because I then started thinking about dedicating myself as a professional to this treatment and to try to help scoliosis patients, because a lot of patients like myself here, they do things, and they think that this is the good way of treating scoliosis, but actually they are going in wrong direction. And what was very important for me is that the only thing we have to introduce that we don't have is knowledge. So you have physiotherapists working with patients, you have rooms with equipment, you have orthotic technicians, plastic, plaster for making braces, everything. You already have it and you're using it, but you're using it in a wrong way. So the only thing is actually to give the knowledge, to educate people and to change the treatment, to give the opportunity to those patients who can have good reaction to get it, to have it. Because if you don't try, it's for sure that you won't get good reactions of the treatment. So if the treatment is wrong, then of course result will not come. And this was, let's say, the idea that I had. And even though my idea about specializing some field in medicine was going towards internal medicine or something like that. So I was interested in cardiology, in pulmonology, things like that. So I was really not interested in rehabilitation and orthopedics. I wanted to go away from this. But then, in life, I think now I can say that when you say that you are not going to do something for sure, you are going to do it. So this is what happened to me. This is not the only case, but one of the cases when I told that I'm not going to do that. But now I'm making braces for patients and I'm doing the exercises for patients, even though I thought that this is not going to be something that I'm going to do. I just wanted to improve my condition of my spine. I spent with Dr. Rigo 1 year in his institute. At his institute, I actually realized while I was doing my treatment during 1 month that the treatment is very complex and that I don't have skills to learn it quickly, So it's something you really need time. It's not something you can do for 5 days, 10 days, I don't know, 1 month. I did it as a patient, but I was not thinking that I can do it now as a therapist. So this is why I asked Dr. Rigo if I can come for a longer period. At the beginning, we did not have a especially defined year or period of time, and because I still had to finish my faculty here to give some exams. So then in the end, it was 2010 when I came. The proposal from Dr. Rigo was to spend 1 year, which was again very surprising. So Dr. Rigo's again made a very, let's say, a generous offer. I really was, I did not even imagine that someone is going to offer something like that. So he invited me to come and to learn from him, to learn about exercises, specific scoliosis-specific exercises, and to learn about braces. And of course, I accepted. I have to say that in the beginning, I really did not know what I accept, because I was never, I had a brace, I was wearing a brace, but I never went to a workshop to see how this is done, how the brace is done. So I was never in the workshop. And I thought that, I don't know, what I expected was that he's going to show me how you decide about the brace design, how you do the fitting, things like that, the checkups. But actually, the whole process of manufacturing, I was not expecting him to show me everything, And then, and then when I came, he told me, oh, tomorrow, for example, we are going to the workshop and you're going to see how we are going to make the brace. And when we went there, I was standing by his side, and he was making the brace by his hands and explaining me what is he doing and how, and I was really, it was, I don't know, life-changing, when you see something like that. When I came back, I actually had no previous plan about what I'm going to do when I come back. I just went there to learn, and when I come back, we will see what I am going to do. So this is how I did. When I came back, I really had no idea what I'm going to do. I was just, I have finished my studies. I was not employed, and I came from Spain with a lot of knowledge, but I needed a space to implement this. So first of all, I needed a workshop where I can make braces, and then I started searching where I can do this. First I went to Belgrade. I'm from Novi Sad, so then this is quite a long journey to go every day to the workshop and back to Belgrade. But I thought that in Novi Sad we don't have a workshop where I can do braces. So, but then what happened in one of those interviews with owners, or let's say directors of orthopedic workshops, one of them told me, why are you coming to Belgrade when you have a workshop in Novi Sad? And actually that workshop is the workshop where my braces were made when I was a child, and still the same people were working there. But I thought, as many companies were closed, I had the information wrong, obviously, information that this workshop is not working anymore. On the other hand, this workshop is quite close to my house, so it was a very good opportunity, if it's possible, to make braces there. I tried, I went there. It was not easy. They were not very interested because they were still working, but very, let's say, just basic things, and they were like trying to close, not working, not making a lot of things. So it was still with people from years before, but they were not very interested in producing something big. And then they told me, you know, maybe you can use our workshop, but I think we will not have a big, let's say, we cannot help you a lot, you know. So you can work, and our people are dedicated to what they do. Sometimes when they are free, they can help you, but most of the things you are going to do by yourself. And that was quite fine for me. I was able to, I thought that I will be able to manage most of the things. So I can say that in the end, this was also very nice experience with those people. In the beginning, they were looking at me like, this girl is crazy. No, she finished medicine, and then she comes to a workshop, a dirty workshop, you know, to make braces, and she's doing it all by herself. And on the other hand, those braces look very weird. So it was the first time when I make a first brace, it was like, how you think that this is going to fit on someone, you know, it's so strange. But in the end, I think that they were, I had a lot of energy and a lot of enthusiasm, and they were, I think, happy to see this in a young person. So they really helped me a lot. Nowadays, I have my own workshop. I make braces again by myself. I have people helping me, but most of the job is done by myself. Usually people who are helping me are part of my family, so they are, let's say, all the time supporting me. I make braces not only for patients from Serbia, but I can say for the region. So it's Montenegro, it's Bosnia, Croatia, Bulgaria. So countries that are near Serbia. Many times people from there, they come for a brace. A lot of patients from Bulgaria come here. And I really have a very nice collaboration with them, with Borislav Chongo, physiotherapist from our school, who lives in Bulgaria. Also in other countries, in Croatia and in Montenegro and in Bosnia, I have physiotherapists who are familiar with the method, and we can communicate very well. So they understand me, I understand them, and then they make easier the follow-up of the patients. So those patients who come to me and if they are not from Serbia, usually are patients of physiotherapists who are educated in this method, so they can help. My philosophy, well, I can say, when I treat patients, what I'm all the time thinking about is that patient has to accept this scoliosis as a part of himself. So this is very, very important thing. If we don't have this, then many times we have problems also with the treatment. So very important point is accepting this fact that you have scoliosis. Also, what I always intend to do is to educate the parents and, in the first place, the patient about the correction. So nowadays you can see many therapists doing exercises, scoliosis-specific exercises with patients, but without giving them knowledge about scoliosis and principles of correction. My idea is that a patient has to know principles of correction in the same way as a physiotherapist. So this is why, because this is the only way how you can explain the exercise, the only way how the patient can really apply these exercises in the right way. So it's not enough just to say, put this hand here or this leg here and do then what you need to do, but you really know to go deep and to explain to your patients principles of correction and then to start working with them. So this is, maybe I can say, the philosophy. So I try to help them accept the fact that they have scoliosis in the first place, and then on the other place I try to teach them to do exercises and to know correction by themselves, not to be dependent on any physiotherapy center or person or anyone. So they have to learn it and to know it very good by themselves. So this is the way I work. My message for the end would be that even though the information about having scoliosis is not a happy one. No one is happy when you get this diagnosis. But my message for all the patients and for all the parents is to try to look at the bright side. So maybe it's not good to have scoliosis, but you always can get something good even from having scoliosis. I can say for myself, and this is something I tell many times to my patients in order to motivate them to go forward, is that until now my scoliosis gave me more good than bad things. Thanks to scoliosis, I am now able to help a lot of children, because without this scoliosis I would never pay attention on this field of medicine. So this is good. Also, it helped me travel. So I went to Spain. I had opportunities to meet a lot of good people working in this field. Then I also can say that because of scoliosis, I was always doing exercises and taking care of my physical condition, of my muscles, about my health. So we can say that scoliosis can also have good influence on you, not only the bad. So maybe the best is to try to think that way, to try to find positive things in having scoliosis. Don't be afraid. Don't live in how to say, anxiety and thinking only about what if this gets worse, what if I in the end get with pain or whatever. Just try not to think about that, and you never know, maybe you will have problems, but then if you have it, you will try to solve. It's not good to in advance be scared and live with this let's say anxiety, because something can happen.